You may be a person who's already been diagnosed. You've gone to a lab or you've had a home sleep test and it's shown that you have sleep apnea, and the sleep medicine physician gave you a CPAP and you have not been able to wear it. Now, that's actually not uncommon. Statistically, 50% of people that have obstructive sleep apnea that are given a CPAP machine will not wear it long term. So although it can be a very effective therapy, unfortunately for many people it's not, because they're unable to be compliant with it. Now, there's several reasons why many times patients can't use CPAP. The number one reason typically is no one has looked in the nose. The nose many times is very blocked, anatomically blocked. Everybody understands it's very difficult to pump pressure through a closed hole. So if you're trying to pump pressure through a closed nasal airway, the pressure requirement is way too high, and having that level of pressure pushing on your face and nose at nighttime is just not going to be comfortable. It produces claustrophobic sensations, or even subconsciously the patient will take that off. So even in people that have very severe apnea that can't tolerate the CPAP, many times we just need to do a simple office procedure like the balloon sinuplasty procedure, get the nose open, and then they'll tolerate the CPAP. On the other side of the spectrum, many people really don't have severe apnea. They have mild apnea or moderate apnea, and the therapy itself is so cumbersome that it produces more arousals than the actual disease. So the CPAP is worse than the sleep apnea as far as they're concerned. So fortunately, that's kind of a lot of the focus of our practice. Tell those people, by doing a good evaluation of their anatomy, what are their options? Can we cure this without the need for CPAP? And in many, many cases we can. And as we may have reviewed already, basically that's by opening up the nasal airway and identifying the factors in the throat that contribute to their apnea and resolving those. Most of the time that's about a 15-minute office procedure. And we follow them closely over a period of about 6 to 9 weeks until we arrive at success.